Hi, I'm Josh Mailman. I'm here to speak to you today on patient advocacy. And really, the big question is, how you can help. And so we want to talk a little bit about patient advocacy today and some of the things that LACNETS has done, NorCal CarciNet has done, and many members of our community have done as well. I'm the president of NorCal CarciNet, but more importantly, we all are patients first. And that's really important when you get into patient advocacy, to understand that your health comes first and take care of yourself, because we all have stories. And actually, part of being in patient advocacy or doing patient advocacy is being able to tell your story. And I'll talk about that in a second. But my patient story is, pretty easy or very straightforward. I was a blind pickup in 2007. Not like other people in this group. I did not have any symptoms going into this. I attended my first conference after joining a support group in Toronto in 2008. And that actually led me on a kind of a whirlwind travel to go to Germany for therapy and also for my first Gallium-68 scan in 2008 as well. While I was doing well, I asked my oncologist this really simple question: how can I help? And that led me down this path of advocacy. So actually, what exactly is patient advocacy? Because it's different depending on who you talk to or the context that you're in. So just a quick thing, if you look in most places, this is it's really one phrase that has many hats. It's an area of specialization in healthcare, and this is probably more of a technical term. It can help patients navigate through healthcare systems. It can be something where you're getting help with your doctor directly. Activities could also be things like patient rights, matters of privacy, confidential, informed consent. I bolded awareness building, support, and education of patients, survivors, and their carers, because that's something actually we do pretty well in the NET community, and I'll talk about that again. But really what patient advocates do is they give a voice to the patients, to the public, and to political and regulatory worlds. And that's what I'm going to talk about, and how you can contribute to the advocacy world and to give a voice to our disease and to patients everywhere. So how does the NET community stack up when we try to look at this? Now, as I said in that earlier definition, there's so many ways you can describe advocacies. It can be individually on the patient level of supporting a patient, being a patient advocate or a navigator in one way. It can also look at how we will deal with research, how we deal in the world of politics or fundraising or even watchdog. And so what we do well in the NET community, obviously you're here today at an education conference, and there are LACNETS puts on things every month. CarciNet Foundation puts on things every week. We do really well in the NET community in the support and education of patients. We do a little less well in the education of survivors and their carers, although LACNETS and my group NorCal CarciNet have separate caregiver groups as well. We do pretty well in awareness building. I didn't completely bold that out because we're really do build awareness with either our zebra logos or other things that we do, but we don't seem to get a very broad audience. What we might need work on, I put fundraising. We do good jobs in fundraising for some of the foundations, but we need to work to figure out how we're going to spread this around across the multiple entities that need fundraising. Patients' rights, we don't, as a NET community, do much in patients' rights or matters of privacy and working on informed consent and patient representation in various different areas, regulatory bodies, and we'll talk about that as well. Where I have spent my time personally in advocacy, in the support awareness fundraising area, I'm the president of NorCal CarciNet Community, and we offer support and education as well. I also work with the Society of Nuclear Medicine and Molecular Imaging. I was the chair of patient advocacy, as well as their working group, which will for Gallium-68, which we'll talk about. I'm a board member of NetRF, where I've also worked on fundraising at large for the community. In research, I work with many nuclear medicine docs in Warmth, which works on molecular therapy. was on the NCI task force for NETs. I'm now on the steering committee for patient advocacy and the steering committee for all GI cancers. I'm an FDA patient rep. I've worked on the research committee in many different areas, and recently I'm the patient PI of the PCORI CarciNet study, and we'll talk a little bit about PCORI as well. In May 2021, I'm happy to announce that I was appointed to a 4-year term as a Patients' Rights Committee to the Nuclear Regulatory Commission Advisory Committee on the Medical Use of Isotopes. So this is another area where I'm contributing in patient advocacy. So research, and I want to talk about this a little bit, research and policy advocacy is different. We're really aware of the education and support advocacy that we do and LACNETS does as part of NorCal, CarciNet, and LACNETS, but research and policy advocacy is different. But the really good thing is there are classes for this, because you have to follow what's going on in the medical literature on your disease and perhaps over many other diseases as well. Luckily, there's a class for this. There are many classes, as a matter of fact, because we've been working with patient advocacy now with things like the National Cancer Institute for nearly 30 years. And I have a couple of different areas where you can get ideas on how to educate yourself if you're interested in research and policy. But one of the books I give to many new patient advocacies in the research area is something called When Science Offers Salvation by Rebecca Dresser. It's a great book that tells you, really understands your roles and responsibilities as a patient advocate. It's not to cure yourself, but to understand how your role as a patient advocate can help work to cure others and to make sure that the best science is being done for your disease or condition. And yes, there's a lot of study behind this. As a matter of fact, PCORI, which is the Patient-Centered Outcome Research Institute, spends $320 million or more a year in research. That was the 2016 number. And the really great thing about all of this is they actually put all of their data online. And so this is just all the citations or all the research that they funded. You can see over 1,000 different studies that they've actually done that have been patient-led or patient-involved studies for diseases. There's actually plenty of areas to engage across the continuum of drug development, from the FDA, which has an entire website dedicated to patient engagement at the FDA, to looking at different things that you can do between Europe and the FDA as well. So the good news is there's a rich history of patient engagement to learn and build upon. We are different. NETs are different than other diseases. So our voice is really important if we're to get what's needed for NETs through design and development or get funded. We do have willing partners. You can work with your local institutions that may have things for NET cancer, or they may have things that help in the general hospitals. They're the clinical trial groups. We call them the cooperative, like SWOG or other things like that, where they're looking for patient representation and understanding how patients will work with clinical trials. Often the pharmaceutical companies are looking for volunteers, not just for clinical trials, but to guide them as to what would make a good trial. We work with medical societies all over the place and regulatory and government agencies, as I spoke about, with either the Regulatory Commission, congressional agencies, other things that you can do even at the state level as well. We also need to support our researchers with dollars and time, because we have things that are happening that may just detract our researchers from working on NETs. We need to make sure that we're putting up money to keep people interested and involved in NETs. So we can lead to better outcomes. It can take time, but you need to be diligent in what you're doing. Your activity may not lead to something right away, but it may lead to things down the line. One of the things I'd love to talk about here is this is one of the ways that advocacy can work. This was work that was generated from a meeting that Giovanna and I attended back in 2017 in San Diego regarding better patient-doctor communication. And Giovanna and the LACNETS crew ran with that and created this great tool in partnership with City of Hope and Dr. Dan Lee, who's been here today, and created this great tool called Net Vitals. And you can see it was an accepted abstract in the 2020 eNets conference. This was released in 2018, I believe. And again, this is a great example of where patients can notice something, create something, and now it is a tool that is used by clinicians as well. We can make an impact. I talked a little bit about Net Vitals there, but these are some of the things that we've worked on in NorCal CarciNet. We've worked on in 2015 with the FDA getting the gallium-68 DOTA trials expanded when there weren't very many. We've done things with the Nuclear Regulatory Commission when they were going to take germanium-68 out of production to make sure there was adequate supply. Just recently, members of all of our groups worked on writing letters to Humana when they were going to cut coverage of PET CT coverage for patients, not only NET patients, but all patients. And that was able to be reversed, which is fantastic. And you can advocate beyond nets. This is a picture of the ASCO ACT network. And they're working right now. You just put in your zip code and you can see what types of things that are generally available for cancer. This is expanding telehealth, which we've all grown to appreciate, but it's really something that we might lose not only in the NET community, but all over as we exit this pandemic at some point. We may lose our flexibility in telehealth. And here is ASCO looking for help in advocating on behalf of these things. And there's several different aspects that we can take a look at as well. Not sure where to start? Well, we've got a couple really great examples right here. We have LACNETS, which could always use your help, your time, your dollars, or your local support organizations. We have national organizations as well that can use your help or your contributions. We have research policy and patient rights. The cooperative groups that I said are always looking. There was recently a call out for rare disease advocates for SWOG, which many of our members in NorCal CarciNet applied for. So there's these cooperative groups, these research centers in your local area as well. You can join our mailing list. I have it right here that will help you find when we find new things that NET patients can get involved in. We send letters to our advocates to help advocate on behalf of these things. So I want to take a moment to thank you all for listening to this. And remember, you can sign up to be part of our advocate list just by going to bit.ly/netadvocate. And I hope you enjoy the rest of the conference and look forward to the Q&A.